Infection control in hospital definition. Infection control refers to the policies and procedures used to prevent the spread of infections within hospitals and healthcare settings. Goals of infection control: prevent hospital-acquired nosocomial infections, protect patients, healthcare workers, and visitors, promote safe and hygienic hospital environments. Main principles of infection control: hand hygiene. Wash hands before and after touching patients. Use alcohol-based hand sanitizer if hands are not visibly dirty. Use of personal protective equipment: PPE, gloves, gowns, masks, face shields when required. Properly remove and dispose of PPE after use. Aseptic technique: use sterile equipment and maintain sterility during procedures. Prevent contamination of wounds, catheters, and fur lines. Environmental cleaning: regular disinfection of patient areas, beds, and instruments. Safe waste disposal: infectious, sharps, non-infectious. Isolation precautions: separate infected patients to prevent cross-infection. Use contact, droplet, or airborne precautions depending on the disease. Sterilization and disinfection: sterilize surgical tools and reusable items. Disinfect surfaces and equipment between patients. Waste management: use color-coded bins, e.g., red for infectious, yellow for sharps. Handle biomedical waste safely. Education and training: regular training for healthcare workers on infection control measures. Encourage a safety culture in hospitals. Common hospital-acquired infections: HAs, catheter-associated urinary tract infections, CAUTI. Surgical site infections: SSI, ventilator-associated pneumonia, VAP, central line-associated bloodstream infections, CLABSI, methicillin-resistant staphylococcus aureus, MRSA. Nurses' role in infection control: maintain hand hygiene. Follow standard precautions. Educate patients and families about infection prevention. Report any infection outbreaks immediately. Monitor and document infection signs in patients. Thank you for watching. Please subscribe for more video.